Next drug is Punarnava. Now, Punarnava, whenever we take into consideration, we think of the Shotahara property of Punarnava, which is very true. But this Shotha of Punarnava is not the one what we have discussed before while discussing the actions of drug named Gokshur. Here the action is altogether different because the Panchabhotik Sanghatan of Punarnava is altogether different than what was in case of Gokshur. So Latin name of Punarnava is Borevia diffusa. Family is Nyctaginaceae. Botanical description is perennial creeping herb with stout and woody roots. Useful part is root or the moola. Active ingredient is beta-sitosterol. Rasa is tikta. Virya is ushna. Vipak is laghu and guna are again laghu and ruksha. Doshagnata of this drug is kapha, vata, shamak. So again, the Panchabhotik composition of this drug makes it liable to reach up to the blood vessels, and the Shotahara activity is then shown at that level and not because of the diuretic activity of this drug which was found in Gokshur. So this drug being Laghu Ruksha and Sukshma Gunatmak, this has a capacity of reaching up to the blood vessels, and while after reaching the blood vessels or the site of action of this drug, it removes the excessive jala dhatu from the blood vessels, and then in that way it can reduce the swelling or the pedal edema. So actions of this drug have been explained by Bhav Prakash as follows: Kasa Rudroga Shulasra Pandu Shofa Anilartinut. So what we have to take into consideration is the shofa, that is the swelling or the pedal edema, which can be tackled with very well with this drug in case of cardiac patients, but with yet another pathophysiology or the action of reducing the swelling is altogether different in case of this drug. So once again we can repeat that it removes the excessive jala dhatu from the blood vessels, and in that way it can reduce the pedal edema. Second important therapeutic indication which was mentioned by Bhav Prakash was Pandu. So in one single shloka there is a mention of Pandu, Shofa and Rudrog. So all these three pathologies may be interlinked with each other. There may be a cardiac patient coming across you who is having anemia and who is having pedal edema or swelling in the body and the cardiac with associated cardiac anomaly. So in such patients you can always think of using Punarnava for relieving the swelling or the pedal edema. Now research activity conducted on Punarnava signifies its role as a cardiotonic, as a fibrinolytic and as a calcium channel blocker. Now whenever we say cardiotonic activity, in this case we can consider this cardiotonic activities again on the basis of the Panchabhotik Sanghatan of this drug, and also on a very relevant synonym which is given to this drug as Rasayani. So as we have already discussed that the Sanghatan of this drug makes it liable or capable of reaching to the blood vessels, and the action of Rasayan is shown at that level. Previously we have discussed that these certain Rasayan Dravyas can help in reducing the Ruksha Siratva at the region of blood vessels or the inner lining of the blood vessels, so that the further lodging of the Medha Dhatu or the Apachit Dushita Medha Dhatu can be prevented in that cases. Over here as well, Punarnava can help in reducing the aging process of the blood vessels. So it is essential for maintaining the wear and tear of the blood vessels, and it will make the blood vessels themselves so much capable that they will not be affected by the action of Vata dosha, and hence these siras will themselves, because of the Ushna Guna of Punarnava, will themselves repel against the Rukshatva which is brought in their area because of the vitiation of Vata dosha. So in that way they will eliminate the aging process occurring at the site at the site of the seras or the blood vessels. Another important activity is the calcium channel blocker and the fibrinolytic activity. So again, we can think of using this drug after the just acute phase for its fibrinolytic and calcium channel blocker activity, which can help in prevention of formation of clot, reoccurrence of a formation of clot in case of a thrombolized patient, and also for the sake of as an antihypertensive agent, we can also think of using this drug. Dosage of this drug is 1 to 3 gram in a BD dose. We can use Punarnava. Next drug of discussion is Kantakari. Now Kantakari, as the name suggests, it is a very prickly kind of herb. There are so many spikes found in this herb, and it is found as a perennial herb and very commonly seen. Kantakari with a very belongs to Solanaceae family, and its Latin name is Solanum suratans. Now these group of Solanaceae group of drugs, they have a characteristic feature of inducing sleep, and hence they are included in this category. So this is again another important therapeutic aspect of Kantakari, that it can be used in patients having insomnia. In such cases, rather than using any other sedative drug, we can think of using Kantakari because it will be Nidra Janan as well as Rudhya at the same time. So it will give you both the benefits in one single patient. So we should always think of pairing the drugs in such a way that would be useful for both the elements what we are going to tackle with. So it is found, as I said, it is found as a prickly perennial herb and has berry-like glabrous fruit. The fruit resembles brinjal because the family is of course the same, Solanaceae. Useful part is root. Active ingredient is glucoalkaloid saponin. Rasa is katu tikta. Virya is ushna. Vipak is laghu, and guna are laghu, ruksha and tikshna. Doshagnata is kapha, vata, hara. Now actions of Kantakari have been described as Hanyat kapha marut kandu kasa medha krumi jwaran. So definitely it has been mentioned as a Rudhya Dravya, but at the same time we should also take into consideration that Kantakari is one among the Dashamul, and hence Shotahara is the inherent property which this drug has got, and hence for any cases of swelling in cardiac patients, we can always think of using Kantakari because of its Rudhya as well as Shotahara property. So again, as I said, it will target both the things, both the elements will be targeted by using one single drug. So Hanyat kapha marut kandu. We will leave apart kandu for a moment and we will think of Hanyat kapha and maruta. So the pathophysiology or the prakrut gati of prana and udan can also be maintained by this drug, and hence the action is basically on the pranava strotas, that it will maintain the prakrut gati of these types of vayu, and hence indicated in kasa, shwasa or other elements related to pranava strotas. Not just these elements, Kantakari being Krumigna, this Krumigna action is also expected not only at the site of Annava strotas or the Krumis which are occurring in the site of Pakvashay or Amashay, but also the infective pathologies which are occurring at the site of Pranava strotas can be dealt with the help of Kantakari. So whenever we are thinking of any infective pathologies occurring at the site of heart, that time we can also think of using Kantakari in our various combinations. The action on pranava strotas of Kantakari can also be signified with the help of its antihistaminic activity, and hence it is also described to be as Kandugna because of this antihistaminic activity. Being tiktarasatmak, it is also a very good aruchinashak dravya and hence also indicated in associated fevers in cardiac patients. Now, talking about its specific effects on heart, it is kaphagna and it is shotahara. It is anti-inflammatory and it helps in reducing excessive secretions and may help in pericardial effusions. There was one more drug which we had discussed previously, which was indicated in parshvashul or pericardial effusion, and that was pushkarmul. So pushkarmul and kantakari should be taken into consideration when we are thinking of a patient who had previous history of pleurisy or pericardial effusion. More predominantly, if a cardiac patient coming to you and complaining of parshvashul or mild pain continuously in the back region, around the chest region, then that time we can always think of using drugs like pushkarmul and kantakari in our combinations to relieve that pain as well as acting as rudya simultaneously. As I said, being krumigna, it is also indicated in various infective pathologies, and we can also think of using it in rheumatic heart disorders. Research conducted on kantakari signifies its effect as a hypotensive effect. So it is also hypotensive, and we can also use it in antihypertensive patients. Also, the antitussive and antibacterial effect of this drug has been proved. Again, because of its action on pranava srotas, these activities are more signified. It also helps us to relieve the swelling or the inflammation that is occurring at the site of bronchus, and at the same time any infection which is which has been lodged at that site, and then ultimately to remove out all the sthanokapha or the mucus which has been secreted because of all these infective pathologies occurring, can be relieved out, can be removed out by antitussive action of this dravya. We can use a churna of kantakari mula in the dose of 3 to 6 gram BD, and we can also use the kwatha in 40 ml BD dose. Next drug of discussion is again a rasayan dravya, and yet another drug for treatment of diabetes, and this drug is haritaki. The Latin name of haritaki is Terminalia chebula. Family is Combritaceae. Botanical description is a large tree with ovoid glabrous fruit. Useful part is root. Active ingredient is chebulic acid and vitamin C. There are many chemical constituents in this drug, which makes it a very good choice of drug for antioxidant use. So previously I have discussed about dadima. Haritaki is one such drug again, which we can use as to achieve a good antioxidant role. Rasa is haritaki pancharasa alavana. All the rasas except lavan ras are present in haritaki. Kashaya ras is pramukh ras. Virya is ushna. Vipak is madhur. Guna are laghu and ruksha. Doshagnata is tridoshahara. So again a very diverse kind of panchabhautik sanghatan and rasavirya vipak of this dravya makes it a very unique acting drug, and hence included in the list of rasayan dravyas, which can be used in cardiac patients, not only in just cardiac patients, but I'll say cardiac patients associated with other ailments like obesity, diabetes, etc. Also at the same time will act as a rasayan dravya. So Bhavprakash has mentioned about the actions of these drugs as Meha Kushtha Pranaschardi, Shofa Vatasra Kruchrajit, Vatanulomani Rudya, Sendriyanam Prasadani, Santarpana Krutan Rogan, Prayo Hanti Haritaki. I believe every line mentioned by our acharyas has got some significance. If Rudya Guna of Rudya therapeutic activity of this drug has been mentioned while just after mentioning its Vatanulomak action, that suggests we can use this drug as a Rudya more specifically in the patients who are complaining of Baddha Koshtata or constipation, and we are expected to use a drug which can show a Vatanulomak or a mild laxative or an Anulomak activity in such cases. Also, after mentioning Rudya, it has been mentioned as Sendriyanam Prasadani. So, as I have always mentioned, it is very essential for cardiac patients not to maintain or not to give tarpan dravya for their body, but also for their mind. So their mind and all their indriyas should be nourished equally, just like their body, so that their mind gets capable of bearing or continuing all this treatment and giving them a booster for continuing their life. Also, it acts on Mutrava Srotas and shows a Mutral activity. Dravyaguna activity of Haritaki is also proven. As I already said, Anulomak activity is the most important which is seen in Haritaki, in case of Haritaki. Now, this Anuloma activity again helps in giving the Prakrut Gati to the Vayu. Whatever disturbances have occurred in Apan Vayu are automatically going to reflect or revert back on the Prana and the Udana Vayu, and they are going to harm the heart. So whenever such back pressure is getting generated on heart because of chronic constipation, in such cases Haritaki can be used to give the Prakrut Gati to the all types of Vata. Research activity conducted on Haritaki explains its role as antioxidant activity, as I already mentioned, because of all the good and free radical destroying chemical constituents which are present in Haritaki make it capable of being a good antioxidant drug. Fruit extracts of Haritaki show cardiotonic activity and increase the force of contraction and the cardiac output. So this suggests its use in treating hypotension as well. So it will increase the force of contraction and it will increase the cardiac output. We have discussed similar Kashaya Ras at the beginning, which was Arjun, which was having a Panchabhotik constitution of Prithvi and Vayu. Similar drug we are coming across again, that is Haritaki, which is again having Kashaya Ras Pradhan, and again this drug will also act on the Mausa Dhatu, being similar Panchabhotik constitution in the heart, and again it will also increase the force of contraction in case of cardiac patients. So this drug again stands out to be important, being Rasayan and being useful in all other cardiac ailments as well. Also, hypoglycemic activity and hypolipidemic activity of this drug has also been proven. Now, whenever we think of hypoglycemic and hypolipidemic activity, here the Ruksha Gun of Haritaki comes into play. This Rukshata and this Laghuta of Haritaki is necessary for removing or doing the Meda Lekhan and for also the Kleda Lekhan, and hence this drug is indicated for these disorders. Now, as I already mentioned, diabetes can be tackled off only when we categorize the patients into two sections, that is the obese patient and the thin or the lean or the emaciated patients. So this drug is again indicated for such obese patients which are having the complaint of cardiac disorders and obesity and diabetes. As I will come again to the last line mentioned by Acharya Bhav Prakash, which says that Santarpana Krutan Rogan Prayo Hanti Haritaki. That means it is the best drug for Santarpan Janya Rog, that is those people who are having obesity and diabetes associated with cardiac disorders with hyperlipidemia. In such cases, we should always think of using Haritaki, not only because of its therapeutic aspect but also because of its rehabilitation or the preventive aspect, being a good Rasayan Dravya. So Haritaki we can use in the dose of 2 to 4 gram as a churna.